We're here once again with Dr. Russ for Standing. Dr. Russ, great seeing you again.
Good seeing you.
We've been spending a lot of time talking to Dr. Russ on these interviews, and I've been spending a lot of time talking about him on the air. Today we have an opportunity to get some real-life information, and we have a very special guest, right, Dr. Russ?
Yes, we do. We have one of my patients, Mary, who was originally sent to me by her primary care doc to deal with an opiate problem that actually started as a result of some hospital complications and then triggered psychiatric problems, triggered relationship problems, and I thought that Mary's situation is one that is actually more common than most people realize in terms of the overlay between substance abuse issues and just life struggles, and she was kind enough to offer to come in today.
Mary, thanks so much for being here.
You're welcome.
So, a mom of 6, that keeps you busy. You have a full-time job at a professional office, and you find out you have a hernia. You go to the hospital. Pick up the story from there.
Yes, I go to the hospital. I have outpatient surgery very late in the afternoon, so we stayed overnight, thank God, because at that point I just stopped breathing, went into a coma, stayed there for about 3 weeks, and then life changed. Because I woke up, didn't know where I was, who I was, what was going on. No clue. Had to be retrained to walk,
Wow.
to talk, to be here. Obviously I did okay in some of the areas, but with that I also have a tremendous amount of back issues, probably from sports in younger days, which came into play that I needed pain medication. I just couldn't make it through the day, and I have a very busy day. Thought nothing of it. It's prescribed. It's okay. It's good. Well, it was good, as we say, until it wasn't, and it got ugly real quick. Real quick.
How fast, just for people watching this?
Well, I mean, of course I thought I had it under control for a long time.
But in
Played that game, and
looking
looking
back,
back, I would say probably within a year, it really went to hell.
So it happened very quickly for you,
Yes.
and your life changed completely.
Dramatically. A lot of things changed because now you need more money. You start juggling your finances to get what you need. Now you need people too, because, you know, if you're going to pain management, things are counted and watched. They're managing you, but you manage to find a way.
Was
And
there
you
any
start-
part of your life that wasn't affected by this?
At that time? No. I don't think so.
How much about how you had to cover your tracks?
Oh,
you
for
know,
God's sakes, it's all you think of. First thing you wake up in the morning, last thing when you go to bed at night. Do I have enough pills to get up and not be sick tomorrow?
and that,
Problem.
And that laid the groundwork for ultimately what became family distrust, because this woman who was the pillar of the family suddenly is running a secret life to manage this
Oh,
need.
absolutely. Sneaking and, terrible things. Terrible things you put yourself through. You do. And never in a million years would I have thought that would happen to me.
And in all this, in addition to all of the other aspects of your life that it affected, it brought you to some depression as well.
Oh, sure. Well, first, I mean, just coming out of the surgery alone, I was depressed. I was annoyed. This happened to me. How dare it happen to me? It's in the best physical condition of my life. Very annoyed it happened. Couldn't understand why. Couldn't get any answers as to why it happened. But it did. And when I finally did, you know, come to realize that, you know, I needed pain management. That's what I needed. I mean, I kept going to primary care, and he said, you know, look, I can't keep writing you these scripts. I mean, it was excessive. It was really excessive. And I have all kinds of x-rays and everything to legitimize what I'm saying as far as pain goes. It's not that, you know, but it doesn't matter. It doesn't give you the pass to do what I did.
So you're obviously having trouble with the substances. You're also having trouble with depression, which really leads us into what we've been talking about with Dr. Russ for so long now, the combination of the addiction medicine and the psychiatry to really combat this. So you were fortunate enough to be told you needed to see Dr. Russ. Let's take it from there.
Well, I was glad to see Dr. Russ. I wasn't glad at first because, you know, of course, it's very personal, it's private. You don't really feel like telling everybody, I have a substance abuse problem. You know, it's a little embarrassing. Someone like me doesn't have that. But I do. I did. It's under control now, thanks, Doc. But
So that
it was a long road.
So that's the first thing you deal with, obviously. The
Well,
substance.
well, I'm curious, Mary. Looking back, you came in pretty demoralized, kind of not having much hope. What was the first thing that maybe started to feed the belief that maybe there was a way out of this for you?
Well, I did start feeling better. I didn't have any, drug cravings in order
because
to...
of the Suboxone.
Exactly.
We put her on a Suboxone
Right.
program.
But that's the Band-Aid, because otherwise, there's an issue there. Why are you doing this? Why would you do this? You know better than to do this, yet you did it. So that I needed to get to the bottom of. And Doc's helped me a tremendous amount. Understand and control. It's just like an impulse almost. It's like really awful. Awful.
So for those people who are dealing with this, like Mary, if it were to stop at the Suboxone level, you really haven't accomplished what you need to accomplish.
In Mary's case, in my opinion, unfortunately, we didn't walk this road, but had it just been go get Suboxone, she was very depressed. She had a lot of pain. I think that, even though we used the Suboxone optimally and we stopped her withdrawal, I think the depression and or the pain would have been likely to have driven her back. And then there was all this family fallout from, just as Mary said, how does this happen to me? The family is saying the same thing. How does this happen to you? At the same time, they're realizing by her inability to serve that pillar of the family role just how important she was, and their lives all became more complicated. So there was a serious domino effect, and I fear that had it just been straight Suboxone, I don't think we'd have a sober woman with a sense of optimism and, unfortunately still, some pain issues which we've moderated, but there's still limitations. But I don't think we'd have a person who's happy about life today.
Tell us, Mary, the difference between the day you met Dr. Russ and who you are today.
There's the very big difference. First, I was afraid. And of course, I have to tell personal issues too, which I'm not very open about. And he made it very easy when I went there. Very easy for me. I didn't push. He waited. He was very patient. And you need to be patient with this because it's hard. It's personal. It's secretive. It's all your deep, dark secrets. And he made me very comfortable, and I'm glad that he was as patient with me, because I'm not so sure I would be that patient with me.
What about with the role of your husband in this whole thing?
He was very good about it, honestly. I really put him through hell and back. And Doc really helped the family unit, because what I do does affect everyone else. I'm mom, I'm a wife, many hats I wear. And I need to be able to get that all into perspective. What am I doing? What's going on? Why am I doing this? Do I have to do it? Is there any other way? I can't go back. I know where I'll go. There is no managing it. I can't. Obviously.
And you're talking about the substances.
Absolutely.
There. So you have no doubt, even though we now have several years of sobriety, that if, gee, this weekend my back hurts, I'll just take a couple of Percocets and run.
No. Mm-mm. Can't do that. I can't. But we're finding other ways to deal with it. And a lot of it's trial and error. But we're finding other ways that are non-opiate.
Are you doing it?
Yes.
Well, we can't thank you enough, because I know how difficult it must be to share that, but it's very important for so many people to hear. So thank you for your courage and continued success.
Thank you. I hope someone gets help from this. Don't hide.
Dr. Russ, thank you.
Okay, and thank you, and thank you for coming in and sharing the story.
Zach,